It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hello everyone, I'm Grace Sells along with Jim Knox, and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Dallas-Fort Worth area that are really changing people's lives.
Exactly right, Grace. And speaking of best, we'll start with our first best doctor. That is Dr. Naila Malik, helping her patients feel better about themselves.
Aging is a multidimensional process which starts in the surface and involves subsurface structures, including skin, fat, muscle, and bone. So the way we determine the best treatment for anybody's aging face is by looking at the extent of aging they have in each one of those layers. The CO2 laser will address your skin surface problems like texture and fine lines and deep lines and some collagen and elastin production. The radio frequency will address the skin tightness below the skin, and then you can use dermal fillers such as Radiesse or hyaluronic acid fillers to account for the loss of fat that occurs with aging as well. It is important to know what your patient needs based on their face shape and the type of aging you have. When I saw Jennifer, she originally came in asking for an option of a filler for her fine lines and deep lines above the lip and nasolabial folds. But after examining her, I determined that the CO2 fractional laser was probably the best choice for her. And she had the added advantage of having a tremendously great response to the CO2 laser by improving her elasticity.
My only knowledge of cosmetic procedures was filler and Botox. And I was told that I would probably need a facelift a few years ago by someone else, and I was dreading the thought of going under the knife, and that wasn't for me. So I was very thrilled when she told me this is basically a facelift. And sure enough, I had it 5 days ago, and I am absolutely thrilled with the results. And what's even more exciting, she says the results are even better as you go a few months down the road. So I'll continue to see improvement. I am completely blown away that for as simple of a procedure that it is, it has completely changed my life.
The response of each individual patient to these treatments is very, very different. It depends on their genetics, on their lifestyle, and so many other things, the amount of stress they may have at that time. So you cannot really have a cookbook that every patient is going to need the CO2, radiofrequency, and dermal fillers, even if they look the same at the first visit. So you really have to step back and look at their results and see how the results show up over the next several weeks before you decide to do a second treatment.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off, and I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
Drink green tea. It's packed with heart-boosting and cancer-stopping polyphenols that black tea doesn't offer. Green tea also delivers a boost of alertness, but from a smaller dose of caffeine than black tea. On our website, bestdocsnetwork.com, we have a map that can help you find the best doctor that's closest to you, which could be our next doctor. It's facial plastic surgeon, Dr. Yadro Ducic.
It's important to first determine that if they're an appropriate candidate for a facelift or not. The general principle is you have to have enough looseness of skin and redundant skin to be a good candidate for facelift. If you don't have enough looseness of skin or laxity, it just won't work very well. You have to preserve the central third of the face, so this oval, if you will, because that's really what defines us as uniquely individual.
I am getting older, and teaching is my 3rd career. And what I observed was the older looking teachers were losing their jobs. And I just wanted to look as young as I could. I had tried a variety of other things, other procedures, and I finally decided to just go for it and go to Dr. Ducic and get everything fixed up. I was impressed by his place of business, as well as his people were all very friendly and helpful, and they just made me feel comfortable. It was overall positive experience, and I felt like he really knew what he was doing.
We have so many minimally invasive techniques available today that really have very little downtime, have excellent results, and make you look more youthful and fresher, because that's the whole point of everything. It's the point to look better. And however we can accomplish that, that's easiest on the patient, that's what we want to do.
I don't think he does things that don't need to be done. So he doesn't push more than you would need, whether that be shots or surgery or whatever. He does what he thinks is going to give you the best result. I definitely am glad I had this done. Most people have no idea how old I am, so I feel pretty good about that. Nobody's tried to fire me for being too old to teach, so I feel pretty good about that. And I'm very happy with the results, very happy.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day, specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures, as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
I had a bad problem of grinding my teeth. And 30 years ago, I had some beautiful teeth. And, you know, they slowly got worse and worse and worse. And then, of course, I started having cavity problems. And my regular dentist told me, look, they're not going to last your lifetime. So you're faced with either dentures or you know, redoing your mouth.
Many patients find us because they're at the end of the road on their dental history. They have neglected their teeth, or they've had habits that have caused their teeth to wear down to the point where they know they have to do something. And they present sometimes after many decades of problems, and they're ready now to fix those problems the best they can afford to. A lot of the patients fall into the full mouth reconstruction category, which means they need every tooth in their mouth addressed in their treatment.
When I finally went to Dr. McFadden, I was looking to him for a permanent solution and something that would last the rest of my life, obviously. And then calmly brought me into his office and literally wrote down on a piece of paper, here are 3 different proposals. After weighing it, I decided to take the highest cost option for me, which was to put crowns on every tooth.
When Bob came to the practice, it was a really fun appointment. He was instantly charming and fun to be around, and we became friends throughout his treatment. When Bob arrived, he had had 4 decades of tooth grinding and ended up with almost no tooth structure left, and his wife hated his smile. We were able to use all of his teeth and perform certain procedures to allow him to keep his natural teeth and improve the way they look through crown treatment. One of the funniest things about Bob is that he carries his before and after pictures on his iPhone. He shows everybody. He shows people that don't care at all what his teeth look like and how great his teeth look now.
He cares, incredibly cares, how good your teeth are. A little bit obsessive compulsive he is, but it works out in your mouth to be beautiful.
Did you know that establishing a bedtime ritual helps your body know when it is time to sleep? You can establish a bedtime ritual by doing the same things, such as brushing your teeth, reading a book, or listening to soothing music every night an hour or 2 before bedtime to relax your mind.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest, so it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient. And the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid. So about 9 years ago, I came up with a new idea. No scar at all on the chest, no drainage tube. We're able to remove the 2 components of gynecomastia, the fatty tissue and the glandular tissue, through an incision this long under each arm. And there are 2 instruments that allow us to do it. It's the use of ultrasonic liposuction, and we have a multi-jointed cutting device. We're able to cut out the rest of the glandular tissue with an instrument that goes through this incision all the way down to the nipple. After we've cut all it out and it's perfectly flat, the last thing we do before closing the incisions is to re-inject the entire field with a long-acting anesthetic called Marcaine. So when the patient gets up, we've already got the compressive garment on, they're pain-free. They're typically only in the recovery in 45 minutes to an hour, and that stays numb till the next day. They wear the compressive garment under their street clothes for 3 weeks, and they're done. We see them at 8 to 10 days post-op, or we see them 6 weeks after that, 3 months after that, and they're delighted.
For more information about any of our outstanding doctors you see on today's show, head to the website. That's bestdocsnetwork.com, bestdocsnetwork.com.
Now up next, we're going to hear from orthopedic surgeon, Dr. Charles Toulson.
I had gone from such an active lifestyle to a life of where sitting, standing, sleeping, trying to turn, trying to walk, getting up off the sofa was a major ordeal for me. Any kind of movement or non-movement was excruciating.
Brenda is in her 60s. She came to me because she had severe arthritis in both of her hips. She had seen other doctors. One doctor prescribed injections, but they only lasted a few days. So we found that she was indicated for bilateral hip replacement because she had severe arthritis in both hips.
After an examination, he goes, I have good news and I have bad news. And he says, well, the bad news is both of your hips are in really bad shape. He says, you're going to have the bilateral hip replacement. The good news is I can do it, and I'm happy to do it. Dr. Toulson also had a model of the hip. And he said, this is what the procedure's going to look like. And he talked through the whole thing, and he says, you're going to be a new person once you have these hips in.
It takes about 6 to 8 weeks for a patient to recover from hip replacement. But when you do both at the same time, it literally takes about the same amount of time for them to recover. This in particular makes bilateral hip replacement an ideal surgery when you have the perfect candidate. Because Brenda was very healthy, we were able to accomplish both hip replacements in one setting.
After surgery, I woke up and I cannot begin to tell you how wonderful it was. I was without the pain that I'd had over 2 years.
Brenda is doing amazingly well. She is just so happy and happy with life. She walks 3 to 4 miles a day. She has no pain. She's able to do everything she wants to do in her life, and we're extremely happy with her outcome.
I just cannot thank Dr. Toulson enough for giving me back my life. It's truly a gift, and I will be forever grateful.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Brain tumors can be a very scary thing. I see a lot of patients who think they have a brain tumor. Most of the time they don't. Brain tumors are rare, but they can be very bad. So how do you know if you have a brain tumor? Well, headaches from a brain tumor usually are severe. They usually progressively worsen in severity and in how frequently they occur. And often they occur in the middle of the night. A headache that awakens you in the middle of the night is always a red flag to be checked out. Doesn't mean it's a brain tumor, but it just means it needs to be checked out to be sure. Also, if you have a brain tumor as the cause of your headache, you'll likely have other symptoms. For example, vision changes, double vision, numbness or weakness in one arm or one leg, inability to speak, maybe even a change in your bowel or bladder habits. So if you have any associated symptoms with a headache, or if it's a headache that is new, different, severe, and progressive, then talk to your doctor. Those are danger signals that need to be checked out.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors. And with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patient's success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area. Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day, specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
For more information about any of our outstanding doctors you see on today's show, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. Right now, it's time to introduce you to our next best doctor. It is cosmetic surgeon Dr. Michael Thornton.
I'm a yoga instructor and fitness instructor, and I've had 3 babies. And after having all 3 babies, I started to realize that no matter how hard I worked, no matter how much weight I lost, how much muscle mass I put back on, I wasn't seeing some of the changes that I wanted to see.
When women have children, their muscles in their abdomen separate, and they sometimes don't come back. And so what happens is that's how they get the little pooch in the lower abdomen region, and it stays there for life.
Before I met Dr. Thornton, I didn't know what I was going to need to have done in order to feel like myself again.
She had a very interesting problem with her abdomen, meaning that she didn't have a lot of skin to remove, but she had a huge separation of her muscles.
He convinced me and explained to me the things that I needed to do, and that no matter how much fitness I did, I wasn't going to see the changes that I wanted to just because of, having 3 babies and what it does to your body.
I came up with a plan with her. It's called an umbilical float. You can't force that procedure on everyone, and you have to pick that person exactly. And Taya was the perfect person, so she had a mommy makeover. With her, I did the minimally invasive tummy tuck, where I just make a small incision in the bottom, and I release the belly button, and it allows it to float upward. And then I go all the way up to the almost near the breastbone, and I sew up her muscles all the way from the breastbone all the way down to her pubic bone. And that literally brings her abdomen back into its normal alignment so it gets real tight. And then I just stitch her belly button exactly back down where it was before, and then I pull out the excess skin. Well, good candidates in particular for mommy makeovers are just women who are between the ages of 35 and 45. That's kind of our average that have grown kids and now they want their body back. Usually it's some sort of breast revision surgery in combination with abdominal revision surgery. So when you're done, they have improved breast and they have improved abdomen. And that's really what the mommy makeover is.
I am so glad that I went with Dr. Thornton. I'm so glad that I had this procedure done because I feel like myself again. I now feel like I look how I feel. It was probably the best decision I ever made.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Sunscreen is unlikely to stop you from being sunburned or reduce your risk of skin cancer if it is not applied properly. Most people do not apply it correctly and stay out in the sun too long. Be sure to put plenty on and reapply often.
Well, my goal is to give people what they want as much as I can, and usually I can do that. I pretty much have been blessed where there's not very many people that say, I can't help you. In fact, I can't really think of anybody. We try to give them a great smile. We do a lot of things that other dentists have told them, well, no, I can't do anything to help you. And I've actually had dentists who refer patients to me, so I'm very honored by that. We try not to just go in and, just do it a cookie cutter type, one size fits all. I try to individualize it for the teeth because I want to be as conservative as I can. I want to do it as comfortably as I can for people, minimal invasion on their tooth structure that's in good shape. So I'm not just trying to talk everybody into doing veneers or doing crowns or whatever. I mean, some people come and want that, and that's fine, but I try to give them options. I try to say, yeah, that is an option, but here's another option, and this might be better for you because ABC. And so we try to work with them and work within their budget and what they can do and what they want to do. What I love about what I do is how it changes people's lives, especially someone who was unhappy with something that had done earlier, that came here to get it fixed. Because they're more desperate sometimes than the people who had anything done. They're disappointed, they're hurt, they were wanting something and they didn't get it. And to be able to take someone like that and to show them it's okay, it can be fixed, it can look fantastic, and to take them and to guide them through that and help them achieve what they wanted to achieve originally and fix it for them is really satisfying. It really makes you feel good about what you're trying to do. I had one guy in with his wife, it's like she won't shut up about her teeth, and she's talking to everybody about it. And so I love that. And getting Facebook posts from patients and talking about how I love my dentist and things like that. I mean, that's awesome. There's a lot of satisfaction in that, and I really enjoy that.
That's going to wrap up this edition of Best Docs Network, the show that features some of the best doctors in the Dallas-Fort Worth area that are really making a difference in people's lives.
And for more information about any of these outstanding doctors, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question, a comment, or a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.